Try to get green.
I'd like to call to order the Law Enforcement, Public Safety, Health, and Welfare Committee meeting for October the 3rd, 2023. It's 4:30 p.m. on a Tuesday afternoon. And let's have a moment of silence. Mr. Root?
Pray with me if you'd like to. Dearest Father, our Creator and Provider, and you who take care of us, protects us, just keeps us safe, and looks out for our welfare. And I know that you use instruments such as law enforcement, our first responders, all those involved in the safety of the public. And so I just pray that you would enthuse them, guide them, protect them as they help carry out the job, really, of keeping us safe. And so we can do business and do your business. So I pray that you give us guidance during this meeting so we can help chart the path forward. In your name I pray. Amen.
Amen. Director Crine, would you lead us in our Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next order of business is approval of the minutes for July the 18th, 2023. Do I hear a motion?
I'll make a motion.
Second it.
All in favor?
Aye.
That is 3-0.
The discussion items for today's meeting, we've got 3 items we'd like to talk about. First up is Sheriff Mike Crenshaw with an update on alternative to the incarceration program.
Good afternoon. I appreciate this opportunity to kind of come before you and give you a little bit of an update on where we're at with alternatives to incarceration. You know, any given day now, we're averaging 220, around 220 in our detention center. As you know, we've got a bed. We're built for 200 beds, so we are constantly overcrowded. But instead of looking at building bigger jails and more jails, I want to look at how we can help people. And so that's what we've been trying to look at with alternatives to incarceration. This morning we had graduation services, exercise for ceremony for 6 of our state inmates. It's just completed Tri-County Technical College Ready to Work certification program. It's the first time that we've had a college inside our jail, but 6 of our state inmates graduated from that. We acknowledged them this morning and are looking now and partnering with the school district to start a GED program this fall. We've identified a group of county and state inmates that are very interested in getting their GED, so we're going to try to coordinate that. We've actually have worked with Borg Warner to get some grant funding to help us offset any cost, testing costs, things like that for the program. And this month, I know Ashley Williams gave you an update from ORS. We've partnered with him. We were notified this week, first of this week, that we received a grant for $1 million, a federal grant for $1 million. That we will facilitate through ORS to expand mental health services in our jail, to expand the addiction treatment program that ORS is currently offering, to expand some transitional housing and cover some cost for some transitional housing for inmates after they, or someone after they complete a drug treatment program. But real excited about that. You know, really the part about it being able to expand mental health services in our jail and being able to cover some of the costs. This was a non-matching grant. There's no county tax dollars coming from this. This is all a federal grant. And we applied, and I was pleasantly surprised that we were awarded the $1 million this week for that. Later on this month, ORS has also gotten some grant funding to start a alternative to incarceration, but it doesn't necessarily have to be someone that's incarcerated. This is available to anyone in Oconee County. Years past, I've encountered someone that was addicted to drugs and they wanted some help. Well, 3 or 4 days later, when I would line them up a place, I'd go back to them. Well, I really don't need to go now. You know, they wouldn't go. 3 or 4 days later, a week later. So what Ashley has done is increase his staffing, that he's willing to take somebody 24 hours a day, 7 days a week. So if there's a citizen in our county, a family in our county that has a son or a daughter that's suffering from addiction, and they want to go get some help, they can go, and it's free. It doesn't cost them nothing. They can go into Ashley's program. It's the 30-day program that he's having right now, about a 70% success rate with that program. You know, if a deputy is out somewhere and encounters maybe a son that's assaulted his father, and the father doesn't really want to press charges, but he wants his son to get some help for his addiction, that deputy can bring them straight to the old jail, and they'll go straight into the 30-day program. We've talked with our magistrates. When someone gets out on bond for some minor offense and they've got addiction or need substance abuse, the magistrate can make it a part of their bond that they go into the addiction treatment program. If they fail to complete it, it could constitute a violation of their bond, and they would go back to jail. So we're currently are setting up training this month for all law enforcement in Oconee County, every police department, highway patrol, DNR, anybody that brings anybody to our jail, and providing this training, this guidelines for them, how it works, who to contact. And Ashley ORS will be ready to start this program later on this month. So just wanted to kind of give you an update on that, of what we've got going on with alternatives to incarceration. Any questions?
It's outstanding.
Thank you.
I think it's great that the federal government provide us with that $1 million grant too.
Yes, sir.
Glenn? Matt, any questions? Excuse me. Next up, Director Crine is going to give us an update on Mercy Services.
Scott Crine, Director of Mercy Services. Just want to say thanks for the opportunity to come out today and update you on a few things. So often we're up here asking for stuff, and I want to take some time to just kind of give you an update on some of the things that we had asked for and where we stand. One is the grant and the approval of the opioid reduction coordinator position almost 4 months ago now, and we've already had 135 first responders and firefighters trained, and with that training we get free Narcan to put on the unit. So that's about over a $40 investment for each person as we go through for that unit in savings that we're no longer, as it's replaced, it runs out of date too, they replace it. A lot of that stuff, we do the training, but having their training and what's called the ROLL program training, they actually replace it. It's a federal program that gets pushed down through the state to actually replace that, so it doesn't come out of county funds. So that coordinator position's significantly pushing that. So we've gotten the full departments, Long Creek, Walhalla. I know Station Fair Play has gotten their whole department operational over 80%. is considered full for the program. Rescue One, our busiest rescue squad, actually has the most overdoses in their area, has also got that taken care of for that. And we have multiple pending classes to literally, we're trying to push through every single volunteer, every single staff member, any facility that we can manage to do that. Also working through with that same program, CPR for every single county member to make sure it's available. So no matter if you were to show up at any county facility, that person or someone there would at least have baseline CPR. Because we know in an overdose, time is of the essence when it comes to a cardiac arrest, and minutes is lives. And so the sooner we can get CPR started by anyone that's trained allows us as responders to get there and have a more viable patient. Presently, motor pool, the airport has been done, talking to a lot of other departments. We've worked with the quarry to make sure that it's one of their requirements within the quarry to work with them for CPR, to make sure that it is out there. And that's not just opioid, it is specifically through that, but that position has allowed us to have a trainer available for them and to push that through any county agency as we go through. The other one is about a year and a half old now, and it's the Community Medic Outreach Program. And we have basically started a high utility group, of utilization group that is, if someone calls 911 a lot, what do we need to do? How do we reduce it? And what we find is that's some of the reason why we have a 911 issue, is that we get so many repeat calls. So this community medic program has specifically addressed 42 residents that were high calling. I wish I could say it was 100%. Some of which there's a medical need there and they have to have help, and they're a transition period. They just need help for a while to get out. And others had other problems. We rebuilt a kitchen so that the person didn't fall every time they tried to cook a meal. And we use volunteer organizations. Through the other group that we did, we brought partners in on this, and the food pantry kitchen and those, and we have a online program for our responders now, but it was based on the where to go for help. So we put it online so any responder, when they go into a home, they can look it up and say, this person just needs XYZ help. They can look up and say, this organization in Oconee or serves Oconee does this for you. So we had a group come in and put a wheelchair ramp in for a family. And the call stopped because we had a call every time the family member needed to go to a doctor. And so we've taken all these volunteer organizations and put them all in one spot where people can look for it. At the food pantry, they get a paper copy and of the same type thing that we fashioned it off of. But for our responders, it's big. It's not just a sheet of paper anymore. It's hundreds and hundreds of organizations that, until we started looking at it, we didn't really realize how big it was. We've been able to use that 42 times to reduce the number of repetitive calls for our volunteers and our staff when it comes to that. Within that, we've done 15 homes for smoke detectors. So we are given by the state smoke detectors to install in residents that people don't have the money to install a smoke detector in their homes, so that they can have early warning within the system. And so we've gone into 15 homes and actually, put them in. And it's not usually just one. We put them in where they have to be now for code, so it's around every bedroom, in a kitchen, those kind of things, so that we can try to make sure people have early warnings. We're also, as outreach, we're special events. We were at the health at Shaver Center today with a booth, getting information out there about opioid, about how do you smoke detectors, do you have it? Safety things within your home, cords, electric cords, trip hazards. We find a lot of throw carpets that people use a walker need to remove because they become a trip hazard. And those kind of things, and filling all that out. And basically building that partnership between so many organizations to where we can send a person to somebody and at the moment, instead of saying, hey, look for this, you need to try to do this. We can actually try to pair them up and do that. It's been a phenomenal program. We got the money again to continue it for at least another year through the state, and that program has been just phenomenal. Two programs that have cost us as a county very little. It's all exterior money, but we are making a difference for our responders and those for that. Then the next one is we are working on the integrated public alert and warning system. So we have a warning system we've had for years. The sheriff and I have a partnership with the reverse 911 system, which is basically how we send all the information out. The present system that we have is an opt-in system, so you have to choose to let us send you information, except for landlines and voice over IPs that are registered. They automatically go in there, but your cell phone is not. So the integrated public alert system is the federal system that we have everything in. We're waiting for the federal government now so that we can send an alert to the area and every phone within that area, and it's called an opt-out system. And so that opt-out system, you have to choose not to get an alert. And most people, it's a setting on your phone, but your phone comes accepting it. And so we will now, when this is approved, using our system, it's tied together to where we're gonna have an opt-in system. So it's about 2 years in the making, but it's a free program. You just have to do all the stuff for it. So, you know, three programs that are finally coming here. We're getting there as we move forward with protecting the public and the people and responders. We'll have a group of responders. If we need to send information via cell phone, we'll be able to do that, and those things within that system. Last thing is the positions. I know I was here last time talking positions. I wish I could say it was solved. It's much better. Thank you very much for the funding and those that came in this year. The best I can say is we had 22 applicants. 11 showed up, which is still a lot compared to where we've been. And we'll be offering positions soon, hopefully to get them. Some are trained, some are not. It's been a long time since we've actually had trained people actually applying, and this time we did. And so that's good news for us to start filling the open positions that we have. And then when we do open the Badlands Station, those positions, we'll work getting those filled once we get that moving forward. The generator was put in service Monday officially on the building, and we got our CO, and it's getting tied in, and we're finishing up that. We do have some, we're waiting for grass to grow to finish up for the water permit and those kind of things, but we're wrapping up that building to where we'll be able to start staffing it and actually making a difference. Both trucks that are in there are ready to go. We're doing some maintenance, some heavy maintenance on one of them before we put it over there to make sure it's ready to go. We're actually have a vendor in checking everything on it, doing a full maintenance before it actually goes back into service after we had pulled it from we had swapped it from another station to use for that as we go forward. And other than that, quick update. I know any questions for me or things you need?
I got a question, and it's really just an informational type question. You mentioned the Narcan kits. Do you have just a general average as to how much in the county that you're having to dispense Narcan on because of opioids or fentanyl?
So, you know, it really comes in spurts, but sometimes it's daily, and sometimes it's at least weekly that we have a unit. And sometimes, you know, the other day we had 3 in a day. And it comes and goes when, unfortunately, a lot of times when the sheriff's office knows this, when some of the drugs come in with bad fentanyl in them and stuff, we see a huge spike because some bad drugs came in, you know, all bad for illegal, but you get the concentration wrong. And we find a huge up spike, so we'll have a time period where it is just constant, and we're hoping that we have enough before the new shipment comes in. And sometimes we were at a point when it became scarce, that we were moving it around to units that just make sure they still had it, the ones who were continually using it. But it's, with this new grant, they're actually supplying us on the state level to get us to a good stock that where we don't have to worry that if you use it, you may not get replaced until it comes from Columbia. They're stocking us for it.
And you also mentioned the fire detectors. Have we got a good established program, school program, where we can get information to the kids and it possibly end up in the hands of the parents in
So-
school?
So we do have a lot of different school programs, and we have, not this year specifically, but we have sent flyers out with every single kid before for different things with all the information for that. And then any event the school has, if we know, we try to make sure, especially different events for kids, we try to make sure we talk to the parents, send them home about not just the smoke detectors, but have a meeting place and make a plan to do that. Presently this year, we haven't specifically done that, but we'll definitely look at making sure we can touch as many as we can to get that home, because the kids bring it home and sometimes, it may just lay there for a little bit.
That's a real good avenue to do. And I only have one other question. You mentioned the repetitive calls you get from some of the families for first responding. And you mentioned about you go in and you fix a kitchen to where they won't fall, or you construct them a ramp coming into the house. How many times have you had to talk to them about their pets? Now, I know I've got a pet, or my wife's got a pet. And sometimes, now he like to got me last night, getting in your feet. Have you discussed that with them? Cause I know they're family members, and that's a touchy subject.
It is a very touchy subject, and that is one of the things that the community medics are great at. They look at the environment of what's in, and we actually do a home inspection. And that home inspection includes everything from pets to the fire extinguisher to trip carpets to electrical cords. If they're deaf, we work on getting a vibrating smoke detector for them. Those kind of things, and there's a whole checklist that they use to look at the environment, to talk to them about what they see at that point. And that's what they're trained to do. They're trained to go in medically, and we're training them also for safety to do that. The same group is doing the child safety seat. So where they can come and get inspected and make sure the seat's actually in their car properly. And so many people don't have it quite tight enough.
Right.
It's in there, it's on, but really cinching it down and making sure it's in correctly saves kids' lives in a car in an accident, even if, we can't control others when we get in
Right.
those accidents.
That's all I got. Any additional questions?
I got one. Do you have on-staff training for first aid and CPR?
Yes, sir.
I mean, you got somebody that trains it to the people that you got coming in.
We do, we have an agency that we do it through, but we have staff that are trained to do it. It's a third party. It's not a county certification. It is actually required for us to be American Heart, but we have on-staff third-party trainers, if that makes sense. It's a certificate. It's not just training. We do training to refresh, but we actually get a certificate through it, through Upstate Upstate EMS is who actually that certificate comes from.
So it's good to hear that the pay is having an immediate effect. I saw ads with the new pay on it. So the fact that you're getting people applying that are trained, and you haven't before, that's a positive sign.
Very much.
As word continues to get out, that'll improve. The packages you have with the information of all the different charitable organizations that can you provide that to us? Because I have people call and they want some type of help or somebody they know, and I end up going on a trail of somebody I think does something, and then, to get to it. That would be very handy.
I will send you the link and you'll have it right to it. But it changes sometimes weekly, so don't print it anymore.
Yeah.
And we keep it updated. We've told all the organizations to, if something changes, let us know, but we will be glad to share that, not a problem.
That's all.
Thank you.
Thank you. And the last item on the discussion items tonight, this evening, Mr. Coley, I don't want to put you on the spot, but could you come and give us a brief update on the junkyard ordinance?
Yeah, so the planning commission met, and I wasn't fully prepared, but to tell you the day, they did determine that they were not going to make a recommendation on the two issues that you had sent back for them with grandfathering and the time limit for grandfathering. So they recommended no further action.
No further action.
Yes.
Okay. Well, then we'll take that under consideration, possibly revisit that subject at a later date. Thank you.
Absolutely.
With that, do I hear a motion to adjourn?
Make a motion.
Second.
All in favor?
Aye.
Aye.